So many people now have the app. If it does go off and, you get the message that you've been around somebody who was infected, what do you do? Do you have to then take yourself to the doctor? You go get yourself a test? What's the process there?
So what will happen is that a public health official in one of the states would call you and say you have been exposed to somebody that's been diagnosed positive. We would encourage you to go and get a test, and I can't imagine there's any situation where somebody would not want to get a test if they've been exposed. And that way they'll have the security of knowing they're not positive, if that's the case, or the support for treatment if they are positive. And it's a very simple thing. You'd get a call from a public health official and which says you've been in proximity to somebody who's been diagnosed. And certainly for me, and I think for everybody, that's peace of mind and it's practical support.
OK. Now on those restrictions that you just talked about in Queensland and WA, do you support those restrictions?
Yes, absolutely. I think those are the result of very, very low case numbers, and they're consistent with the principles of the National Cabinet, and they're being applied wherever you've had very, very low case numbers for a prolonged period of time, and in particular that's been the case in Queensland and Western Australia. That gives us the freedom to return to our normal life, and our goal here is to get back to our normal life as quickly as possible, but subject to not allowing a second wave of the virus. So they've thought it through very carefully. They've worked on the medical advice, and I think it's just a lovely thing for Australians to be able to see small but very important steps, whether it's getting together with friends, whether it's being able to be in the outdoors. These things really make a difference to health and mental health.
Well, there's no doubt that other states, people in other states might be looking at WA and Queensland perhaps with some jealousy at the moment. Will National Cabinet be looking at extending those restrictions nationwide?
They've said that in 2 weeks we'll be looking at the results of this period that we're going through now, and from that we'll be planning out the roadmap. In fact, throughout the weekends and late into the night, I know that it's whether it's the Prime Minister or myself or our medical teams or the other members of the Cabinet, what we're always looking at is the low health risk, high social or economic benefit activities, and they become the priorities as we work our way out of where we're at now. And as a country, we're very fortunate to have that option. There are other countries that don't have that option. We see whether it's the UK or the US, France or Spain, just the extraordinary human challenge and suffering that they've been going through, and we feel for them. But we're in such a fortunate position as a country. We don't want to make the mistake of doing things too early, but where there is a medical case, we'll always move to reduce those restrictions as they've done in Queensland and Western Australia.
OK, so just to clarify on that point, so you'll be watching Queensland and WA closely over the next 2 weeks before looking at extending it nationally?
Yes, that's correct. What we have.
So they're kind of test cases for the rest of the nation at the moment?
Well, they've had very low cases, and so they're doing exactly what the National Cabinet set out, is when you have a prolonged period of very, very low case, and in particular what's called community transmission, cases that don't have a known origin, they're the ones that we most worry about. If that's the situation, that you've got those low case numbers, you've got community transmission under control, then steps can be taken. And so I think it's something, even if you're not in Queensland and Western Australia, it's a sign of hope and a sign of progress, and it means that we're saving lives, and it's a good thing. You
might have seen the pictures of people gathering, in particular in Sydney beaches over the weekend, Minister. Are people kind of flirting with danger there? Is complacency coming in your opinion?
It's understandable, but it's not something that's desirable at this stage. And I recognise that what we're doing is so contrary to our nature, but it's at the same time so vital to our future. So distance amongst all the different things that we can do, keeping that distance is perhaps the most important. And if you keep the distance from others, you can't pass the virus between you. And if you don't pass the virus, then we win. If you do pass the virus, then it wins. And it's a battle against a virulent, by definition, enemy. And we are winning, but we haven't won yet. And so if we can keep that distance, and the measures that we've put in place have simply been about helping people keep that distance, then ultimately that's what's going to put Australia in a position where we've defeated them.
I just have one final question, and I know that you're very keen to get students back in school as soon as possible. There was some interesting comments on the weekend about the CEO of Hoyts, who wants to get people back into cinemas by July. That's the time frame that he wants. I mean, what are your thoughts on something like that? And, is the possible reopening of gyms sometime soon an option, given that so many people are outside kind of getting exercise at the moment?
Sure. So mass gatherings are probably at the later end of anything. Borders and mass gatherings, I know the Chief Medical Officer, the Prime Minister, myself, the medical advisors around the country, we're being upfront that they are later measures rather than earlier measures. There may be ways, cinemas having every seat between people vacant unless they're from the same family group. Those are possibilities, but these are the questions that we're working through very carefully in terms of risk as opposed to benefit. And so we want to get as many people back to work as quickly as we possibly can and people back to their normal lives. But as I say, it's that health safety which is our first step, because if we have a second wave, as we've seen in some other countries, then that brings everything back. And so